Hi, everyone. My name is Deja Williams, and I'm the Environmental Justice Manager for Clean Air NC. It's really great to see some familiar faces from our previous Clean Air Advocacy training. So welcome back to the Historic West End residents that are joining us again. On behalf of my organization, Clean Air NC, and the Historic West End Green District, we just want to thank you guys so much for participating in today's Healthy Air Education series. Today will be the first of two sessions in this series focused on COVID-19 and chronic illnesses, how air pollution influences the impacts of these illnesses, and what we can do to protect our health from that impact. And just to give a little bit more background, this series is a part of educational efforts associated with the Historic West End Green District. I know we have quite a few Historic West End residents on this call, but for those that are not aware of this initiative, the Historic West End Green District is a collaborative effort between Clean Air NC and Historic West End residents and advocates with goals to implement green infrastructure, strategic tree planting, EV charging stations, and community clean awareness programs, such as this one today. These efforts have and will continue with the goal of contributing to improved air quality, better health outcomes, as well as reducing carbon emissions in an area where residents have been impacted by environmental injustice, which we'll get a little bit more in today. So you'll see here on the slide to the right, this is Mr. Ron Ross, Miss Maddie Marshall, and Mr. William Hughes, who helped to get this initiative off the ground in the Historic West End. We thank them fully and the rest of the Historic West End community for their continued support and uplifting of this program. We truly couldn't do it without you. And I should also mention that within this effort is also air quality monitoring with personal Purple Air PM 2.5 sensors. So on this map here to the left, you will see the dots, which represents Historic West End community members that have taken on monitoring the air quality around their homes to become more informed about local polluting sources, to protect their health, and to help increase data around particulate matter exposure in Black and Brown communities, which again, we'll get a little bit more into particulate matter and ground level ozone today, and some other pollutants of concern. And then I've included here a link that has more information about the Historic West End Green District if you'd like to learn a little bit more about what we're doing and how to get involved. So before starting our presentations today, I just wanted to go over some housekeeping as usual. So for starters, as the other webinars that we have done, this one is being recorded and it will be available and sent via email after this presentation, probably in a couple days, along with the presentations of today and relevant resources from today. So I really encourage you to share it with your neighbors, participants in this training that are a part of the Historic West End neighborhood. The Merrickmore neighborhood and other impacted communities will receive a stipend for completing both sessions. So if you have a neighbor that couldn't attend this session and wants to join the second session, please feel free to share the recording with them so they are up to speed and able to participate in the next one and receive that stipend. And the next session will be Saturday, September 24th from 11 to 12:30 p.m. And then after that second session, we will be sending out a survey to learn from you and what you may have gathered and found useful within this series as we look to expand this educational effort across the state. This survey will also help us to determine how Historic West End residents would like to receive their stipends. So be sure to fill out that survey so we have that information. Again, that will go out after the second session on September 24th. And then lastly, a little bit about Q&A. Presentations, we're going to have 4 today. Each are going to last for approximately 10 to 15 minutes each until around 6:45. And then we will address questions within a panel and open up the session for dialogue during the last 30 minutes of the session. So questions will be at the end. After all the speakers have presented. However, if anything pops up during the presentations, feel free to put them in the chat and we'll queue them and make sure that they get addressed. And then if you're calling in today from the phone and you'd like to ask a question, you can press *9 and that'll raise or lower your hand just to indicate to us that you have a question. And then you can also press *6 to mute and unmute yourself. Without further ado, I'd like to introduce our agenda for today and welcome all of our speakers for their time. Again, thank you all participants for your time as well. I will introduce each speaker more in depth before their allotted time for their presentation. However, just to give a general overview, our first presentation will focus on air pollution and inequities as it relates to certain health outcomes and exposure, and that will be presented by Kirsten Miner from Clean Air NC. We will then hear from Mecklenburg County Public Health Department and learn a little bit more about how the county addresses air pollution, and that will be presented by Dr. Raynard Washington, who is the Public Health Director for the department. Following Dr. Washington, we will learn a little bit more about the intersection of health and the environment from Dr. Doug Robinson, whose background is in endocrinology and diabetes health. And then finally, we will hear from Dr. Tracy Ball, who is the founder of Mobile Medical and Wellness. Dr. Ball will be giving a background on the on her organization, as well as some of the services it provides. And then again, after all the speakers have gone, we will open up the floor for questions and dialogue. So with all of that information, I'd like to introduce our first speaker, Kirsten Miner. Kirsten is our health manager here at Clean Air NC. She's a public health professional with a demonstrated background and commitment to holistic health promotion, equity, and advocacy for historically underserved communities. Having served in various public health settings, including nonprofits, local state governments, and other community-based settings, she is looking forward to listening and learning from the experience of North Carolinians and serving as a positive agent of change in addressing health disparities in communities most impacted by systemic racism. Kirsten earned her Master of Public Health from Boston University School of Public Health with a social and behavioral sciences concentration. Additionally, she is a certified health education specialist. I'm really looking forward to hearing from her today. And Kirsten, I will pass it on to you.
Well, thank you, Deja. And as Deja mentioned, I'm glad to see everybody who's on this call, some familiar faces, some new faces, but we welcome you all. And again, look forward to, this should be an ongoing collaboration with the community. So this won't be the first nor the last time that you see me. And maybe as people feel comfortable, it could be virtual or it could be in person. But with that being said, we'll go ahead and I'll provide a very broad overview of air pollution and equities in the country, and with a specific focus, of course, within historic Weston. Deja. So first, when we think about air pollution or poor air quality, what are the sources for poor air quality or sources of air pollution? So there's actually four locations or four sources rather for air pollution. You have your mobile sources, so that can be reflected in busy highways, cars, trucks, etc. You do have your stationary sources of pollution, which includes your industrial sites, which is you see in this picture. You have your sources of area sources rather, which are more agricultural sites and construction sites. And then you have your natural sources of air pollution, which is reflected in wildfires or structural fires. So that's where air pollution comes from. As it relates to North Carolina, the greatest source of air pollution is transportation is number one, followed by the electricity section. So you're thinking about your industrial sources of pollution. Deja? So there's actually 6 criteria air pollutants, but for the purpose of this section, I'm going to focus on 2. Clean Air NC, we focus on particulate matter. Particulate matter, for those who are not aware, it's a particle that is found in smoke, dust, dirt, soot, and salt. It can come from a variety of sources, including vehicles, factories, fires, and other natural or human activities. Particulate matter can actually vary in size. If you look here off on the right, you'll see PM10. So that may be your dust, your pollen, your mold. And then you have your PM 2.5 or particulate matter 2.5, which is very, very small. It's particles, And even though that it is a solid, it's so small, it's actually smaller than a human hair particle, so we can't actually see it. But even though we can't see it, we're exposed to it and we can breathe it in. So that's particulate matter. Then we have ground level ozone, or more times you just may hear it as ozone. So ozone is actually a chemical reaction that occurs. So nitrous oxide, which comes from our cars, combines with volatile organic compounds, or VOCs. When they merge and they are exposed to heat and sunlight, it creates ozone. So if you just think about if you're in rush hour traffic, bumper to bumper traffic, and it's a hot summer day, you may actually be able to see ozone. Unlike particulate matter, ozone, when it's at a very poor air quality day with ozone, you may view it in the form of smog or haze, as depicted in this picture. So that's ozone. And again, in regards of, well, if you can't see air pollution from the human eye, what are ways in which we can actually visualize pollution using what we call the Air Quality Index, or AQI for short? So this map, if you actually wanted to learn about your air quality index, which I'll reference later, and it may come up later in the talk, you can actually visit airnow.gov. Airnow.gov, just for disclaimer, that is looking at federal air monitors. So it may not always be hyperlocal data. However, nonetheless, until we have more local monitoring, which Deja mentioned, our air keepers, for those who have installed PM 2.5 monitors within Historic Weston, that's something that we're working on. So we have more hyperlocal data. So individuals such as everyone on this call, if you want a more accurate reading of the air quality level in your area, you're able to do so. But in the meantime, in regard to air quality index, it's color indicated. Green is being good. Yellow is moderate. So if you're a person with underlying health condition, that's when you want to start making a decision of, how much you want to be outdoors. And then anything above orange, it's healthy or it's unhealthy for all of us. And just in regards of creating an actual image that we can see, this interactive map that you view is actually from the 4th of July of this year. So even an activity such as setting off fireworks can actually create ozone and particulate matter. So in yellow and red, it's a time lapse. You can actually see directly when fireworks were being set off and when was fireworks at its heaviest levels, as indicated in the yellow and red that you see in the time lapse on the map. So when it comes to air pollution in this country and inequities, race is actually the leading determining factor of what levels of air pollution. So race and income, oftentimes they overlap, right? It's not either or, it's and. But in this case, in this country, Black, Indigenous, and people of color are actually systematically exposed to higher levels of air pollution at every income level. And why is that? Is because historically, for many people who are aware on the call, there was systematically racist and discriminatory policies such as redlining, as well as industrial zoning, that was implemented in the 1930s that shaped our modern day neighborhoods and continues to impact us in the present. Most BIPOC or Black Indigenous communities have a higher concentration of pollutant sources in their communities, as well as low-income communities. So more than genetics, your zip code or where you live, work, or play influences one's health outcome. And next slide, Deja. We know, or we refer to that as where people live, work, and play as social determinants of health. So just reading the definition, at every stage of life, health is determined by complex interactions between our social and economic factors, as well as our physical environment and our individual behavior. So the social conditions we face every day, where we live, work, and play, they have a greater impact on our health and life expectancy than the health care we receive. So again, even though that we are all exposed to air pollution and it all impacts us, people can actually be at greater risk despite experiencing the same exposure because of an underlying health condition, which we know this call, we're going to speak about COVID-19 as well as other chronic diseases that disproportionately impact BIPOC communities at a higher rate. So just an example for redlining, I'll provide an overview of what redlining was for those who are not aware of it. So if you look in the far left, this is actually a 1935 map of the historic, or not historic West End, actually Charlotte. So similar, the color coding is a recurring theme here. Back in the 1930s, the Homeowners Loan Corporation actually had these maps, and they wanted to determine, where would people live, who would get approved of a mortgage, which would determine where people live. So if it was green on the map, that was actually considered the best area to live. If it was blue, it was considered still desirable. If it was yellow, it was labeled as declining. And if it was red, it was actually considered hazardous. So regardless of income, even in the 1930s, 1940s, you could have been a very, well off financially as a Black professional. It didn't matter how much money you make. If they wanted to reject you and essentially segregate you into a red light community, they could do so. So that's why even in the present day, a lot of communities are still racially segregated. And what does that look like in terms of social determinants of health? This is actually data from Mecklenburg County's community health assessment. It's a little bit dated, but the outcomes are still essentially very similar. This crescent shape that you may observe in all three of the maps is the historic West End or disproportionately BIPOC, Black, Indigenous, people of color communities. Those same communities, not only do they have greater exposure to pollutant sources, these are communities that have higher levels of poverty, and not only just higher levels of poverty, places that we learn, typically there may be lower educational attainment levels, and even it's a medical desert. So this map is even indicating, what are healthcare services. So what is people's access to quality healthcare services, which we'll learn later on in the presentation. So redlining still impacts our communities and shapes health outcomes. Tasia? So this is just another visual map just highlighting where are sources of pollution. So in this map, the yellow and red indicates predominantly BIPOC communities. And then the green and blue dots actually represent toxic releases or sources of pollution as identified by the EPA. So when you are looking at the map and you see, well, where are most of these green and blue dots located? Again, these represent sources of pollution. You see that they are heavily concentrated in these yellow and red communities. So short term, what are the impacts of exposure to air pollution? Well, short term, just think about like a campfire. You might experience irritation of eyes, nose, and throat. Some individuals may even experience a headache. But chronic exposure over the life course or long term can actually increase risk for a variety of health impacts, including asthma and other respiratory conditions. It actually exacerbates allergies, and it can reduce lung function. We'll learn more about the impacts specifically on children. I did recognize we do have Dr. Aaron Levy, who's a pediatrician and leader within our health program. He will speak more about the impacts from the lens of a pediatrician. But cardiovascular disease, elevated blood pressure, and even for women of reproductive age, expectant mothers, they may experience an increased risk of low birth weight, premature birth, or other adverse reproductive health outcomes as a result to chronic exposure to air pollution. So we do know by now we're 2.5 years into the pandemic. that the COVID-19 pandemic did have a disproportionate impact upon Black and Brown communities or BIPOC communities. COVID-19 does primarily attack the respiratory system. So of course, if you live in an area where there's heightened levels of air pollution, you can only imagine that obviously that can be an increased risk for not just getting COVID-19, but actually having more severe illness of COVID-19 and even increased risk for death as a result of COVID-19, which has been supported by more and more research. And we do have a educational printout that we can share as a resource after the session. Tasia? And then in regards of what are the leading causes of death in North Carolina, this is actually the most recent data. We do see that 4 of the 5 leading causes of death in North Carolina are either caused or exacerbated by air pollution. So air pollution is not just an environmental justice issue. Air pollution it's a public health issue. It's a public health crisis, which is why we engage, one of the many reasons why we want to engage clinicians and health professionals on this call. So heart disease, cancer, COVID-19, and stroke are all exacerbated by air pollution. So now that we're aware of the problem, we want to give you guys what are actual tangible actions you can take at the individual level to protect yourself, especially on poor air quality days. So I mentioned earlier on the call, you can visit airnow.gov to see what the air quality index is in your area. Even better for those who are air keepers in the historic West End, if you want more hyperlocal data, you can, reach out to us if you're interested in hosting a monitor. That's something that we would be glad to learn more about. So you, again, have that local data. And then you can also, we encourage individuals, consider getting a HEPA air filter. You can also create what the EPA refers to as a clean room. So on a day, let's just say, a wildfire was to take place, you find a room in your apartment or your home, you can seal that off. So in this case, I heard earlier on a call, people had windows open, which is great, but on a poor air quality day, you want to close off any potential pollution getting inside of one's home. And then if you are able to have an air filter, you can put the air filter in that room to create a clean room. And especially if you live with a chronic health condition such as asthma, such as myself, or you have a loved one who has a chronic health condition, it's best for them to stay in that clean room during a poor air quality day. And then for those who have smartphones, most weather apps, you can actually check what the air quality is. So we encourage people to wear N95 or a similar particulate mask on a poor air quality day to plan your activities. And then just an example as a walkthrough. So on a very poor air quality day, again, just think yellow, orange, and above. You want to limit your time outdoors. If you are a person who enjoys exercising outdoors, we recommend that you avoid exercising near areas of high traffic, and then limit your time outdoors during peak ozone pollution times, which is typically the hottest part of the day. So that's between 2 and 7. And then I think we all became creative during the pandemic, especially the earlier days. You can still be active. So we suggest indoor activities. So whether that's exercising at your local recreation center, going to your local library, going to a museum, playing board games, you can still be active on poor air quality days. And that's it for me. Tasia?
Thank you so much, Kirsten. If anyone has questions for Kirsten, feel free to put them in the chat, and we will address that again after all of our speakers have gone. But I would like to now introduce our next speaker, which is Dr. Renard Washington. So Dr. Washington was appointed as Mecklenburg County's Health Director in January of 2022. making him the first African-American to serve in his role. He is responsible for directing all public health and environmental health activities in Mecklenburg County, of Mecklenburg County's Public Health Department. And Dr. Washington previously served as Mecklenburg County's Deputy Health Director, leading many of the department's internal operations, including key aspects of the COVID-19 crisis. So I will go ahead and let Dr. Washington share his screen and present.
Wonderful, Deja. Thank you for the introduction and good to be here with you all this evening. Hopefully everyone can hear me okay and see me just fine. I'm going to try to share my screen while I'm talking, and we'll try my best not to replicate too much of what was just shared, but do want to spend a few moments this evening to talk a little bit about the importance of environmental health for the health and well-being of residents of Mecklenburg County. Environmental health is a key part of public health, and I'll talk about that more globally now. I'll talk a little bit about air quality, and then spend some time talking a little bit, just a couple minutes about the potential impacts of air quality or poor air quality on COVID-19 and the pandemic. And then again, look forward to any questions folks may have, and feel free to use the chat. I'll try to keep an eye on that as well as I'm talking. Environmental health is a key part of public health. Many people don't always recognize that environmental health is a function of the health department. In Mecklenburg County, our environmental health team provides a layer of protection that's not often seen, but is really critical to the health and well-being of our community. That includes more traditional tactics like inspecting food establishments to make sure food is safe, to also making sure that their groundwater and wells are safe as well and free from disease. It is a partnership. Environmental health is really a partnership in the county with the public health department, as well as our partners in Louisa, who are responsible for air quality monitoring, as well as our partners at Charlotte Water and other areas of the community that impact the built environment that we live in. Again, what we focus most on is the relationship between people and the environment. And our goal is to really foster healthy, safe spaces for people to eat, to live, work, play, and worship. We also really are intentional about protecting people from threats, particularly those that they can't see. And as has already been described, many threats in the environment to people's health are things that we're not able to see. There are many particulates and components in the air, as well as things in water and other spaces where we may or may not be able to see always. You think about, for example, sometimes people have mold in their houses, or they may have carbon monoxide exposure in their homes. And those are things they can't see, but are really critical safety threats. And of course, as I've already described, we focus a lot on proper sanitation and food and clean water in the work that we do in public health. It's a combination of focus on air, and air is really, really important, but it also includes what we do on land, as well as the water and the waste that we have. And so ensuring that we look at the environment holistically and not simply focused on one aspect of it as we think about how to protect and improve health for folks in the community. The long and short of it, just to get into a little bit of data, currently in Mecklenburg County, we are meeting all federal health-based standards for air quality control, which is good news because it's not always been the case. And so our air quality metrics in Mecklenburg County are in fact improving, which is good news. As has already been described, there are a couple of different types of air quality metrics that are really important for us as we think about monitoring air quality, specifically because as the air quality changes, there can be some of our residents who experience disproportionately health impacts of what's happening in the air because of underlying health conditions like asthma or other types of chronic respiratory conditions. And so it's important that we monitor air quality to make sure that we're still improving, but also so that we can alert the public when we're having days when air quality may not be optimal in Mecklenburg County. Ground level ozone is really important and is much more of an issue in the spring and summer times, and really at its peak in the summertime, and can cause significant amounts of irritation for people who have some of those pre-existing conditions that impact the respiratory system, as I described earlier. And as you already learned a little bit about earlier, particulate matter is also really important for us to be monitoring and obviously work to reduce because those are actually little particles that can get into the respiratory system, can irritate already irritated underlying health conditions, but also can cause additional health effects on their own if you have chronic long-term exposure to those particulates. In our air quality measurement, we do look specifically at a number of compounds or elements that are in the air, found in the air, specifically those where we can trace back to sources of exposure like cars or trucks or plants, or even power plants, not growing plants, as well as, and so these three, so nitrogen dioxide, sulfur dioxide, and carbon monoxide are three of the most common that our air quality monitors are checking for, along with looking for just global presence of particulate matter in the air. Ozone concentration, again, as I described earlier, is one that we are really concerned about, particularly in the spring and summer times of the year. We have decreased our ozone concentration, ground level ozone concentrations in Mecklenburg County significantly over the past 2 decades. And even before the past 2 decades, there was a time where we had several days where we had poor air quality levels that were not healthy for many residents. And overall, as you can see from this graph here, based on the air quality index, our ozone levels have declined fairly significantly over the last 30 years in Mecklenburg County. So our air is getting cleaner, which is certainly good news. And a lot of this is thanks to the work of not just the work of monitoring, but the work that we did to control sources of pollution in the air, both industry sources as well as other sources, to prevent those things from polluting the air further. But the resounding source, the predominant source of pollution for us in Mecklenburg County, and it's true really in many communities across the country, is in fact mobile sources. And this mostly focuses on personal use vehicles, trucks, aircrafts as well, small engine tools, like some you might see on construction sites, as well as trains. So those cars and those kinds of vehicles, on-road and off-road, non-road vehicles, are really the predominant, make up 90% of the ozone-forming air pollution that we have in Mecklenburg County, which really are continue to be a major source. And that's the case again across the country, and many communities are experiencing that. Obviously, reducing this requires a whole network of response activities. When we think about, on the on-road vehicles, how we move people and things around communities, and how we make that more efficient and more healthy is certainly an important factor. I'm just going to keep a close watch on my time here to make sure I don't go over. If we look at sort of Mecklenburg County, and this speaks a little bit to what Kirsten was talking about, obviously we know in some communities the likelihood that air quality is different is greater because in some neighborhoods or communities, particularly people who don't live towards the central part of the county, have to rely more frequently on cars, on-road vehicles to be able to get back and forth to commute to work. And this graph just shows you that you can just see clearly disproportionately in neighborhoods that are further away from the core of Mecklenburg County, individuals are more likely to have to drive. And so more driving obviously creates more pollution, not just in their direct neighborhood, but in the entire community that they, the route that they take to travel to work. If anybody's been on the highways lately, we know our traffic problems continue to get worse in Mecklenburg County, which certainly is will add to sort of the sources of pollution. I want to move quickly through sort of this climate and environmental justice, and I know that's part of the discussion that we're going to be having this evening, and I know Kirsten did a great job setting this up of understanding sort of that the climate-related risk is not experienced equally across communities, and it's really important for us to recognize that no different than any other health inequity or access to any important resource for living a healthy life, we have to ensure that it's equitable in our communities. And so understanding patterns of impact in terms of climate and air quality in a community is important, but also making sure that we're not systemically causing disproportionate sources of pollution in neighborhoods that are also experiencing other challenges. And this graph, again, and I'm sorry to rush a little bit through this, but I do want to be mindful of the time that I have this evening, that, a lot of times individuals who, air quality and health is not a one-to-one relationship. So simply because you live in a community or a city or a county or a state that has greater levels of air pollution, it's not just the exposure to the air pollution that matters. There's a whole host of other factors, including the individual sensitivity in terms of what your own existing health status is, as well as your ability to adapt. So, having, poor air quality and not having the resources to be able to mitigate the impacts of that poor air quality. For example, have things like Kirsten described, the HEPA filters in your home, and having the resources available to respond when there is a climate-related hazard. It is really the combination of this exposure, your sensitivity, as well as your ability to adapt that determines how vulnerable somebody will be to the effects of climate change on their health. And so it's really important for us to think about, in circumstances where we can't dramatically shift or change, or absence the availability of understanding air quality at a hyperlocal level. It's also important for us to make sure people who are already in socially economic disadvantaged conditions have the ability to adapt when they are experiencing. So for example, one of the things we focus a lot on in public health is kids with asthma. And so making sure that those kids are aware when there are days that they might be more sensitive to the outdoor conditions, and ensuring they have the adequate resources, healthcare and otherwise resources to adapt and respond at the time when they may be experiencing disproportionate effects of the climate on their health. Just to talk a little bit about COVID, which has already been kind of mentioned as well. Of course, we know that COVID-19 is a respiratory illness, and certainly no different than any other respiratory illness. Poor air quality can be a huge challenge for individuals who are experiencing those kinds of conditions. And so no different than COVID-19. Then with COVID-19, we have definitely observed individuals, specifically individuals with challenges with poor indoor air quality, which is not something that we've talked a lot about, but I do want to acknowledge that much of the effects of air quality on people's health actually is driven by the quality of air within their homes. And so it's important for people to recognize it's just not sort of the big outdoor air. It really is important that indoor air quality be monitored, maintained, and ensured that it's protected. And so things like the HEPA filters and indoor, like the carbon monoxide monitors in your home, all those tools are really, really important for ensuring that your home, the quality of air in your home is safe. And for people with COVID in particular, if they're working to recover from COVID at home, it's important that they have clean air to breathe in when they're in their homes. And so it's also not just sort of the more sophisticated technology, it's the basic hygiene. So cleaning and dust cleaning and vacuuming, all those kinds of things are really helpful with ensuring that individuals have good indoor air quality, which again is something that we have the ability to modify really, really quickly and improve and change. And so we do spend a fair amount of time making sure folks have that information and are aware of the importance of indoor air quality and the conditions within their home and how it can impact their health. Lastly, Mecklenburg County is committed to environmental health and environmental justice. Our board of county commissioners have done a number of actionable steps, not just in word, but also in finances and planning and resources to ensure that we are working to better understand how climate change impacts communities of color, but also how we take a leadership role in improving the quality of life in Mecklenburg County. So with that, thank you guys for the time this evening, and great to be here.
Thank you so much, Dr. Washington. We really appreciate the county being a resource and a presenter today. And as far as the Environmental Justice Action Plan, there will be a webinar on September 21st for more information about the Environmental Justice Action Plan. And we can share that as a resource in the follow-up email. So I would like to go ahead and introduce our next speaker, which is Dr. Douglas Robinson. who is an endocrinologist and diabetes specialist, recently retired from Atrium Health after a 27-year career. Thank you, Dr. Doug Robinson, for serving as a healthcare professional. Prior to that, he served 10 years as a medical officer and endocrinologist in the Navy. So also thank you for your service. He is a graduate of the University of Pittsburgh School of Medicine and also holds a doctorate in biochemistry from that same institution. He now works as a physician at the Good Samaritan Clinic in Morganton, serves as a legislative co-chair of Healthcare Justice NC, and most importantly, enjoys spending time with his grandchildren. So I will stop my sharing my screen and let Dr. Doug Robinson take the show.
Well, thank you. And I'm going to try to share my screen now. I hope I do as well as Dr. Washington did. Dr. Washington just gave me a shout out from University of Pittsburgh. I went there about 30 years prior to him. So, all right, here we go. I'm going to try and. Okay. Okay, how's that look?
Perfect.
Okay, so my talk is on the intersection of health and environment. What I'm going to try and do is stitch together a number of these issues that we've been talking about: disease, air pollution, social determinants of health. And, you know, an intersection when you're driving is where the collisions happen. And this intersection is where a really unique collision of disease, environment, air pollution, and social determinants of health has come into a sharp focus over the last couple of years. I'm a diabetologist by training and career, but you could insert a number of other chronic diseases instead of diabetes in there. I could easily be talking about cardiovascular disease or hypertension or lung cancer. But since I'm a diabetologist, I'm going to stick with what I know. Let's see. So I'm going to first start by talking about some COVID-19 statistics. And these statistics are a little dated by about a month or so. But at that time, we had just over 1 million deaths in the United States, and our daily case load was about 90,000. We did not do well and have not done well with COVID compared to death rate among other wealthy countries. Certainly some of that is due to our social determinants of health that you've heard about a little bit earlier this evening, and I'll touch on later. Chronic diseases, as you probably all know from the news, increases the risk for severe COVID. And that can be heart disease, diabetes, cancer, lung disease, chronic kidney disease, or obesity. These are the folks that didn't do well with COVID, ended up in the intensive care units and died at a higher rate. And of course, as you also know, people of color, Blacks, Latinos, Native Americans, had higher rates of infections and death than their white counterparts. And then if we bring in to this bad orchestra chronic exposure to air pollution, that makes everything worse, worsens the effects of COVID-19 and increases the risk of death due to COVID-19. There's been a number of studies looking at COVID mortality and particulate matter, air pollution, and they've all come to the same conclusion. And this is a quote from a more recent Harvard study here, that there's an 11% increase for every 1 microgram per cubic meter load of particulate matter. That's how they measure particulate matter. You may have seen a slide earlier where it said the safe range is less than 12. Well, from this study, this is a linear risk. So even at levels below what would be considered a healthy, not healthy, but safe amount of particulate matter, you still see increases in COVID mortality, even under that 12 microgram per cubic meter, so-called safe zone. And we already talked about the size of these particles. They're teeny, but I'm going to take you on a little journey of those particles as they move from the lungs into the systemic circulation and into our internal organs where they do further damage. Even mild infection increases risk of developing diabetes. So not only did folks with diabetes do worse with this disease, but there's now increasing evidence that folks who had COVID, particularly severe disease, are at increased risk for developing new onset diabetes. And that's, I'm going to show you some shocking and scary statistics about that, because we already have a tremendous burden of diabetes already increasing. So we also think that folks who had diabetes and developed COVID are at risk for developing long COVID. I'll just stop for a minute and tell you a bit about long. You hear this term, long COVID, COVID long haulers, called post-acute COVID or chronic COVID. This is a range of new or recurring or ongoing health problems that can be identified around 4 weeks or more after someone has gone through COVID. And there's a whole list of symptoms. Understanding long COVID is really in its infancy, but they can be symptoms like tiredness, fatigue that interferes with daily life. It's worst after exertion, fever, respiratory symptoms like cough and shortness of breath, neurologic symptoms like headaches, sleeping problems, even GI symptoms like diarrhea and stomach pain. So we're starting to understand that there are some long-term consequences of people who recover from COVID-19 infection. In fact, I think it's estimated that 1 in 5 people who have had COVID will have some type of long COVID symptoms. So we're going to pivot now to diabetes and see how that weaves in with this. So about 10% of the population, 11.3%, have diabetes. I'm going to mostly be talking in this talk about type 2 diabetes in America. $96 million people have prediabetes, which is a condition that leads to the development of diabetes. Folks with diabetes had a 6 times higher COVID hospitalization risk and a 12 times higher COVID death rate. And as we talked before, exposure to air pollution increases that risk of developing diabetes. How does particulate matter air pollution contribute to diabetes? Those tiny particles are able to go through the alveoli. Those are the little balloons of air at the in your lungs into your bloodstream and go in your bloodstream. In the case of diabetes, to your pancreas. In the case of liver disease and liver cancer, to the liver, go to the kidneys and cause inflammation. We're just starting to understand how these particles contribute to internal organ disease. And in fact, there was just a study that came out over the weekend showing how these particles switch on a gene that can cause lung cancer. Because all of us in clinical practice have seen people who develop lung cancer who are non-smokers and wondered, why are they getting lung cancer? And this may be certainly one of the reasons, is these tiny particles in air pollution. So in the United States, there's an estimated 150,000 new cases of diabetes yearly due to air pollution. Once you develop diabetes, you are less healthy. So if we take that statistic and take it further, that means 350,000 years of healthy life is lost annually. And again, this is even at pollution levels that are deemed safe. This is a linear risk. There's no safe place to hide from this air pollution. We talked about how the particulate matter moves from the lungs into the blood and eventually to organs. And then with regard to COVID, even mild cases, this is a recent study, cause a 40% increased risk of diabetes up to 1 year later. And if 3 times that risk if you have severe COVID, and you double that again if you're obese. So if we say there's been, I think there's been estimated, and this is an estimate, of course, 95 million cases of COVID in the United States, and there is a 40% increased risk of those folks developing diabetes. we're going to see a tremendous downstream effect of this disease and the burden of type 2 diabetes. We've talked a lot about air pollution already. There's no way around it. It's the burning of fossil fuels, gas, oil, coal, major source of air pollution. Those greenhouse gases drive climate change, which in turns worsen air pollution, and that chemistry experiment in our atmosphere that causes ozone. They estimate that there were 20,000 extra COVID infections and 750 deaths associated with high levels of PM 2.5 from 2020 wildfires in the western US counties. A shocking number. Prolonged exposure to air pollution, we've been over this, increases rates of all these diseases, resulting in this is an estimate, 5 million deaths worldwide in 2017. We've talked a little bit about the social determinants of health. I've boldened the definition of that. Upstream from the social determinants of health are really the structural, they call it the structural determinants of health, which are the policies, social policies, political policies, economic policies that have resulted in these health disparities, including access to health care and quality, difficulty obtaining health insurance, the environmental exposures we're talking about tonight, lack of access to food deserts, and lack of access to green space. COVID-19 deaths caused a 2.9 and 3-year decrease in life expectancy in Black and Latino populations, respectively. That's life expectancy, folks, is going down in the United States, particularly in the Black and brown population due to COVID. They had a decrease in life expectancy due to COVID, 2.5 times that seen in whites. And of course, racial and ethnic minorities have increased rates of the underlying chronic disease that make COVID worse, and they live in more crowded conditions, have limited access to health care and insurance. And these folks are often the essential frontline workers who couldn't stay home and work on their computers during COVID. They had to go into work. And in the United States, I'll just editorialize here, this is my care justice hat I'm putting on, we've linked health insurance to employment. So if you lose your job, you lose your health insurance, and everything I've been talking about here gets worse. And we've already talked about this. The burden of air pollution isn't equally shared. People of color are exposed to more pollution from nearly every source. Well, what can you do about it? We've talked about this as well, so I won't belabor it. Try to get health insurance as you can. I know the ACA, Affordable Care Act, or Obamacare marketplace is cumbersome to negotiate. My daughter just tried to do it. It's tough, but and I see folks in the free clinic every day who probably qualify for Obamacare with subsidy, making it very low cost, and they don't get it because it's just difficult to navigate the marketplace. I'm a big fan of having an ongoing relationship with a healthcare provider. A lot of the disease we're talking about are asymptomatic until they're bad. Diabetes, hypertension, chronic kidney disease. By the time you have symptoms, the horse is out of the barn. So establish with a healthcare provider who will know when to do the appropriate tests. Practice good nutrition, healthy meal habits, exercise, get your vaccinations. We talked about staying indoors on bad air days, using an N95 mask. Don't burn wood or trash, or use electric lawn, and use electric lawn care equipment, and try not to drive an internal combustion engine vehicle as much as possible. Plant trees. Trees actually decrease particulate matter in the environment. They're good for us. I'm just going to drill down for a minute, my last slide here, to end up on preventing diabetes. I mean, folks, what can I do to make my health better, prevent diabetes? Talk to your healthcare provider. I want to emphasize here, be your own healthcare advocate. Nobody can care more about your healthcare than you. Take a list of 3 to 5 questions with you when you go to the doctor. Take someone with you when you go to the doctor. I've had patients, and not uncommonly, come in and say, "Doc, I'm going to record what you say here today." And they record our interaction. That's great too, because a lot of folks can't remember once they've left the doctor's office what the interchange was. What about screening for diabetes? Well, folks over age 35 ought to be screened for diabetes. And I won't go into the types of screening. And that's done about every 3 years in folks over the age of 35. But if you have risk factors, if you have prediabetes, or you've had diabetes during pregnancy, you need to get screened at a younger age. Women who've had diabetes in pregnancy should get screened for diabetes every 3 years. If you're overweight or obese and you have some risk factors, like a first-degree relative with diabetes, or if you're Black or Hispanic or Native American or Asian Pacific Islander, you're at increased risk. If you have high blood pressure, cardiovascular disease, if you have a certain appearance to your cholesterol panel, or if you have polycystic ovarian disease, those are all risk factors that would trigger an earlier screening. Yet we want to catch this in the pre-diabetes state if we can, because we can then turn things around. And I'm going to touch on that. It's going to be the final upbeat thing I say. So if you have pre-diabetes, you want to get enrolled, if possible, in a CDC recognized diabetes prevention program. The diabetes prevention program is a study funded by the National Institutes of Health years ago that looked at lifestyle changes in the prevention of diabetes in folks who had pre-diabetes. And they compared it to drugs. And I'm not going to talk about the drug arm of the trial, but this is the good news is they were able to decrease progression to diabetes by 60% with a fairly modest weight loss, about 7% loss in weight. So if you're overweight, how much weight do I need to lose? Don't focus on your ultimate goal number. Even a 10-pound decrease in weight can decrease your risk of diabetes tremendously. And the amount of exercise they did in this program is not huge. It's about 30 minutes a day, 5 days a week, and can just be a brisk walk. So there are centers around the country, particularly in Charlotte. The YMCA is a CDC recognized diabetes prevention program center. Atrium Healthcare has diabetes prevention programs. This is a year-long program you can enroll in. Many of them have free or reduced fees to enroll. And you can find where these programs are at Diabetes Free NC. So just go log on and go to www.diabetesfreenc.com. And that's all for my talk. Thank you.
Thank you so much, Dr. Robinson. So I'm going to go ahead and introduce our last speaker. And with time, we should have enough time for about 20 minutes of dialogue and questions. So our last speaker will be Dr. Tracy Ball, who is the founder of On Call Mobile Medical and Wellness, PLLC, which is an innovative medical practice that provides house calls in the metro region of Charlotte. So Dr. Ball has combined technology and modern medicine to bring a new approach to an old concept by providing healthcare in the convenient setting of one's home, office, hotel room, or community setting. Dr. Ball matriculated at the esteemed Meharry Medical College, finishing at the top 5% of her class to receive a doctorate of medicine. She now specializes in the area of internal medicine, pediatrics, and addiction medicine. Dr. Ball has also provided care in the community of Charlotte for over 15 years and is happy to call the Queen City her home. Thank you so much for your time, Dr. Ball, today. I will go ahead and stop sharing and let you share your screen.
Okay, great. Bear with me, I'm having a little difficulty getting to the part that I need to. Okay, here we go. Okay, excellent. Here we go. So first of all, thank you for this opportunity to share a little bit about what our group has done in the area of COVID-19, and that's some of what I'm been tasked to share with on tonight, to share a little bit about myself as well as our organization. And oh, it's not advancing for me. Let's see here. Okay, there we go. So a little bit about myself. I have been practicing for about 21 years now. As mentioned, I practice adult medicine, pediatrics, and addiction medicine, and I've always had a passion for community health, and as a result, have gotten involved in a variety of health initiatives across North Carolina. And in 2020, prior to that, in 2012, I intersected that with my passion to become an entrepreneur at heart. And with that, I started On Call Mobile Medical and Wellness. And our goal was to remove barriers of care and to visit some of those places, as mentioned in the bio, going to the home, doing kind of a flashback to what was done in days of old of doing a house call, but then bringing it up to forward time with using technology so that we can really get care to people who otherwise would have difficulty getting care or either lacked access to care completely. In 2020, I was asked to partner with Old North State Medical Society and to become a part of their COVID-19 task force. And with that, I worked on an action plan of helping develop a component of a grant that would later become approved. And then I was asked to implement the actual component where we would go out into the community and do COVID-19 drive-through mass testing out in the community. And so with that, we trained, managed and deployed teams across North Carolina. To date, we have been in 11 counties. We've tested, vaccinated, and treated in areas of disparity. So the thing is, what did we see while we were out in those communities? Well, as mentioned, we already know that there's a great inequality when it comes to healthcare, especially in Black and Brown, or as previously mentioned, that definition of BIPOC communities. And I think one of the things that the pandemic also did is that it really exposed some of the issues that we have with the healthcare system, some of the fractures that were already there in the foundation. But with the pandemic, the Band-Aid kind of got removed, and some of those issues were exposed through media, social media. It was a lot of people sharing their experience. So we see that what was already present to a greater degree was exposed during this time period of the pandemic. And as mentioned before, we saw that those who had chronic conditions, especially those of color, had a much more proclivity to having a poor outcome versus those in other communities. And some of the chronic conditions were already mentioned by Dr. Robinson, so I won't go over those again. But in those who had those underlying conditions, they were at risk of being hospitalized or at greater risk of being ventilated. And unfortunately, they were also at a greater risk of losing their life as a result of those underlying conditions. And so what did we learn that we could do about those underlying conditions? How can we improve health, and how can we improve the possible outcomes of those that have those chronic conditions? Well, as community physicians, what we found were, in our finding, because we're still out there, still looking, still gathering data, is that making small changes within the home and work environment and with our healthcare professional can have a great impact. And so what we saw in the home is that just making changes such as not allowing someone to smoke in the home. Whether it's someone who is a smoker themselves, or there's a smoker that's in the home, so there's exposure to second or third hand smoke, it can have a great impact on health. And if you haven't heard of third hand smoke, what we're talking about is we're talking about the residue. As we talked previously, we heard about particulate matter. That matter that's left on walls, on tables, even clothing, can have a great impact on health. And so just making sure that a smoke isn't allowed in the home can have a great impact. We already talked also a little bit about the environment, bed linens, curtains, carpets, how those can hold certain allergens and also can affect our health as well. And of course, the poorer the air quality, the greater the impact on those types of materials and the greater the impact on the health. And we found that in certain homes, those homes that have those qualities, there's increased risk of their children developing asthma and allergies. And of course, it's within the Black and Brown communities where we find that higher incidence of allergy and asthma incidents as well. Getting rid of pests in the home, roaches and rodents, they themselves can be allergens, but they also can carry diseases that can have an impact on chronic conditions. We talked about purifiers and getting natural purifiers. Dr. Robinson mentioned planting trees, but also bringing plants into the home can also be another great resource for natural purifiers. And then in our work environment, doing that some of those same things, bringing in plants. If we know that the air quality within our workspace is poor, then we can say, you know, there's an issue with the ventilation here in this environment, you know, and advocating for purifiers, advocating for changes, maybe even in the HVAC system with management, asking for a change in policy with smoking. Again, you yourself may not be a smoker, but you may be exposed to second or third hand smoke within the workplace. And so being an advocate for yourself is greatly important to impacting your health. If there's an employee wellness program, you definitely want to become involved in those programs. Many of them are free and they're part of offering as a benefit with your employer. And also they're sometimes incentivized. So there can be a great benefit to be participating in these programs. Please definitely take advantage of those. And then when it comes to our healthcare professional, how can we better that relationship so that we can improve our health? Well, one of the things that you can do, and this is something I always ask my patients to do, is to keep a diary of their health condition. Writing down, you know, what's causing their symptoms, what happened right before or right after their symptoms. Keeping that diary and then bringing that information will help me to make changes to the medications, develop a better treatment plan for them, to figure out some issues that are going on, little changes that we can make to improve their health. So keeping a diary and, you know, as mentioned with Dr. Robinson, with having diabetics, you know, it's been a great resource with keeping blood sugars, keeping food diaries, you know, their activity and movement level diaries, to put that all together to bring a better picture so we can make sound decisions with their management. Also bringing your medications to your appointment, especially the new ones. We really need to know what new medications have been added to your regimen. Taking all your medications as directed. Let's say that if you take a medication and there's an issue with it, you know, you just don't want to stop that medication and then wait until a follow-up visit 3 or 4 weeks later, 3 or 4 months later. You want to make sure you are in contact with the doctor's office to let them know that you may be having an issue or you have a question about your medication. And then keeping your appointments. We all know that things come up, but keeping your appointment is really important to your health, and as well as being on time. And, you know, I understand that sometimes doctors, we can run behind in our schedule. Sometimes emergencies may come up, but also sometimes just someone being 5 or 10 minutes late to their appointment can really push the day back. And if you do that multiple times, they can really impact your appointment. And so we'll be running late to your appointment. So if everyone kind of does their part to be on time, they can really help us give you all the time that's needed to really give you the information, go over your concerns. And with going over your concerns, I really recommend asking questions. Please ask questions. We want you to ask questions. And then if you're like me and you're forgetful, please write those down prior to your appointment. You can put them on your phone. As mentioned, I loved how I do have patients who also sometimes may take recordings or may bring someone with them to help write down notes as we're going along through their appointment. So the goal is that as we gain more knowledge, then we have more knowledge to share with someone else. Bad information travels very fast and far and wide, but we want to make sure that good, sound information that can impact our health and change our life is also being shared out there. And the more we know, then the greater impact we can have, not only on ourselves, but on our coworkers and our loved ones as we share this information. And to me, we can really level up in the level of our healthcare. So that concludes my presentation, and I thank you for the opportunity to share this.
Thank you so much, Dr. Ball. Thank you for all the work that you're doing. We are now going to open up the webinar for questions. So I know we had a few questions come in the chat, but I was wondering, we have a question from Ron, and it looks like it was answered, but Ron, if you want to expand on that question a little bit more, feel free. And then Dr. Ball, if you wouldn't mind, stop like sharing your screen. I think there should be like a button you can press.
Okay, let's see if we can do this.
Joys of Zoom.
I think I can take care of that for you.
Okay, I may need an admin to help me, please.
Okay.
So yeah, we're going to go ahead and open it up for questions. So fire away.
Yeah, this is Ron. So the question I was asking was, specifically to our Mecklenburg County Health Department, as far as what the county is doing to address, again, air pollution, more concerned with the outside air pollution. Again, it's negatively impacted in the community that a lot of us live in, is our close proximity to freeways and high concentration of industrial facilities. It seems like that's where they put them. They put them in our community. So are there some things that the county's doing to address those concerns and extending efforts to inform communities? Was my question.
And Dr. Washington will be available via chat. Something came up, but if there are any other Mecklenburg County representatives that are open to answering this question that are on the call, please feel free.
Hi there, I'm Katie Hunt. I work with Mecklenburg County Sustainability, and I'm so delighted to join the seminar tonight and hear all the fantastic speakers and learn so much. So I can just very briefly provide a quick answer to Ron's question, if that's okay, Deja. Thank you. I work in the county manager's office, and we have in the last 6-8 months, gosh, it's September already, we have undertaken a comprehensive environmental justice study of the county. So we've been spending these last 8-10 months gathering all kinds of qualitative and quantitative data related to a lot of the conditions that have come up in this session, as well as a lot of the structural factors that you just mentioned, Ron, proximity to highways and, industrial sites and so forth. And we are now, pardon me, we are now launching a community engagement phase. I can send through the chat the link to anyone who's interested to RSVP for our community engagement sessions, because we're now gathering community feedback around the kinds of experiences that you're mentioning, Ron. Because we want to hear from folks across our county about your experiences related to environmental justice, air quality, in particular is related to our session today, but more broadly as well, and the priorities that are most important to you and your communities, your neighborhoods, your brothers and sisters' homes and communities, because by next June or so, by summer, we will be developing, out of all of this data that we're gathering and all of this community feedback that we're synthesizing, we will then be developing a targeted environmental justice action plan that outlines specific priorities, metrics, targets, a timeline, budgeted resources, all that good juicy stuff that can help us address these disparities and environmental justice related inequities across our county. So as I mentioned, I'll drop that link in the chat. Just give me a moment, and we would welcome anyone in this session today to join us at any one of those community engagement meetings and share your feedback and your experiences.
So if I might add just a little quick comment, some things that I would kind of recommend would be, if possible, there would be some institution of some air quality monitors. We're trying to expand that within the community. So also monitors, et cetera, that would reflect the AQI, air quality index, for that day. You got people in and out and so forth. Just some little things, and also maybe enhance some educational experiences and so forth. So
thank you, Ron. I appreciate hearing that. And I realize that we don't have representatives from Mecklenburg County Air Quality on the call tonight, but I do just want to plug their efforts. They have launched two, I believe, recently, air quality learning stations. They call them public monitoring stations in parks. I can get those addresses. Daisha, you might also have this information. But anyway, I can say on their behalf that Mecklenburg County Air Quality is working to address exactly those issues, Ron. And I will also be sure to pass along that feedback. Thank you.
We actually have Danielle Jones.
Oh, good.
Mecklenburg County Air Quality.
Apologies.
I think you answered the question. Looks like we had another one pop up in the chat here, which is with air quality negatively impacting Black and Brown communities and other BIPOC communities. Should the messages be the same, such as no masks, 3 Ws, and in-person meetings? And Ms. Maddie, if you wanted to expand a little bit on that question, feel free.
Particularly with Dr. Ball and Dr. Robinson, and the message coming out from the governor's office, it's okay to, the ban has been lifted and it's okay to go back to life as usual, but we know the negative impact of COVID-19 on these particular communities and the health impacts. So my thing to advocate, should we be saying to the community, this is okay, when we know that it's not? People want to think that COVID has disappeared. Should that be the messages, particularly in these vulnerable communities? Thank you.
Thank you, Ms. Maddie.
A quick question from, this is Blanche Penn, Dr. Blanche Penn. A quick question for me is, I heard the presentation where several people talked about, planting the trees, things of that nature in our homes, but they're cutting down so many of our trees, bringing in housing and all kind of property. I mean, they're taking away a lot of our trees. So how can we, or can that happen where we can have some people stop, these investors coming in and taking over and really cutting down so many of our trees. And that means that we got to go out and buy trees in order to plant into our yards and our homes and stuff like that. So can someone share a little bit about what they think about that?
Yeah, Dr. Penn, I'll go ahead and say that there will be a tree adoption on September 24th from 9 to 1 a.m. I recognize that that is overlapping with our second session, but that session doesn't start until 11. So if folks wanted to go out, they're free. I believe there's 200 free trees up for adoption. And again, we'll send out that information via the email that we follow up with. But from Clean Air's perspective and the Historic West End Green District perspective, strategic tree planting, also the maintenance of trees. So ensuring that trees that are already in place are well taken care of to provide the ecosystem benefits that they will so provide is a huge part of our efforts. So if you are interested in learning more about that or getting more directly involved with those efforts, please let us know. But again, our most upcoming event will be in collaboration with Trees Charlotte for that tree adoption on the 24th.
Oh, thank you.
Yeah, and Daisha, maybe I could add something to that as well. The tree mitigation, that's mainly handled, through zoning. I think there's a process where the developer, pays a mitigation fee for getting rid of so many trees and maybe, put some back or whatever. So that's something you have to as residents and citizens, advocate through zoning, maybe for changes, with that as well. But again, that event that's coming up gives us an opportunity for people to get trees free and so forth. And so there's, opportunities for that. But again, at this point, it's more advocacy from within the residents to try to process where they're tearing all these trees down.
And I want to say, when these developers, put in their petitions, for these possible developments, that information is public. So as part of advocacy is that, we can go on to the sites and find out about possible developments that are coming up. We can go to public meetings and we can voice our concerns and give that input that, yes, this may go on, but we desire, as mentioned, certain parameters around it to help protect our environment. So again, we have to advocate for ourselves. On the first question, as mentioned about the messaging, most of the organizations that I'm involved with, we are continuing with the messaging of mask wearing and social distancing and doing all those things that we know have worked and have benefited slowing and reducing the spread of COVID-19. So we are continuing with those messages.
Thank you, Dr.
Thank
Ball.
you, Dr. Ball.
Thank you.
And again, I just wanted to mention that the county will be, Sustain Charlotte will be in collaboration with the county, will be hosting a virtual event around the Environmental Justice Action Plan, which would be a good space for advocacy. So we will send out more information about that as well. Now we're coming up on time. So is there any other questions? And feel free to, as this ends, forwarding questions to me, and I can send them to our wonderful speakers today and get some follow-up on some of the questions if you didn't get a chance to ask.
And this is Ron again. I just would like to add also that I think Dr. Robinson alluded to this, as well as the other clinicians, that there's a limited access of health facilities within the communities that most of us represent. And fortunately, recently, there's been, thanks thanks to donations by Michael Jordan and Novant, there are medical facilities that have been located in the historic West End communities and surrounding communities as well to provide that access. And I guess currently only, one of the aspects of it that I have concern is that it's limited staff, and so there's not sufficient staff, on a daily basis. But again, I guess, it's just in the embryo stages and growing. So I guess that, hopefully will change with time. But those types of amenities being put back into our communities are very helpful to being able to address some of these health concerns that we have.
Absolutely.
Tasia, I just want to add, just added on to what Dr. Ball was suggesting in regards to messaging as it relates to COVID-19. Aside from, of course, people make the informed decision for themselves in regards of wearing a mask, and we reference, you can, whether it's every day when you interact, especially in large settings where there's a higher possible transmission rates, that is important. Air quality index is important, but also boosters, COVID-19 boosters. I know people will make the decisions that they feel most comfortable with, but there are new boosters. Dr. Washington, he's available through the chat, but I would look into, for those who are 18 years of age and older, if you have not gotten the most recent booster is specifically targeting the original strain as well as the most dominant strain, Omicron. So it's strongly recommended. Locate what is the location best for you to get your booster shots as well as flu shots, because when it comes from prevention is key. And we do know, again, COVID-19 vaccine does not prevent COVID, but if you are a person with an underlying health condition and you're more at risk of having severe illness, the booster can reduce the severity of that illness as well. So that's very, very important. So look at that messaging as well.
Absolutely.
I just wanted to quickly, add one thing. So right now with the new bivalent vaccine that you mentioned, anyone 12 years and older is eligible for it. And you have to be 2 months out from any of your last vaccines. So it doesn't matter, even if you've currently received a booster, you can still receive it as long as you're 2 months out from it.
Great. Thank you so much, Dr. Ball. All right, so I just wanted to close us out with some upcoming events. I know we've mentioned several of these several times, and again, these will be going out via email. And I just want to reiterate too, if there is any questions that maybe come to mind afterwards, feel free to email me or Kirsten, and we'll be sure to direct those questions to the proper entities. So just to stay engaged with us, we just wanted to highlight some of the things that are going on with the historic West End Green District. So we will have some green infrastructure projects going in place this year. One of them will be the green pillars that you see here. We've received funding from the city to add greenery to the pillars across the historic West End. We also will be installing a garden near the same area. And so we are looking to start a historic West End green team to help, maintenance some of these sites that, of course, the more of these projects that we get implemented throughout the historic West End, the more benefits that we can bring through green infrastructure, strategic tree planting, and things of that nature. So if you would like to be a part of those efforts, please let me know. Again, the Tree Charlotte, in collaboration with the Historic West End Green District and Clean Air, will be having a tree adoption on September 24th from 9 to 1 p.m. Again, I know that kind of overlaps with our second session, but if you would like to go before or after, they will still be there. And then again, the Environmental Justice Action Plan virtual event will be September 21st from 6 to 7:30. And then, of course, if you would like to host a Purple Air Monitor, please connect with me. I will be happy to get that set up for you and give you all of the relevant information of what we're monitoring, why it's important, etc. As far as clean air goes, If you'd like to stay engaged with us, you can subscribe to our e-newsletter for news, action alerts, and other upcoming events that we have. You can join Medical Advocates for Healthy Air. Kirsten, did you want to talk a little bit about that?
Yes, so MAHA, or Medical Advocates for Healthy Air, where it's statewide. We are inclusive of not just clinicians, but healthcare professionals, researchers, educators. As clinicians, you guys are trusted voices. So your voices are very, very important in joining. We speak about the importance of we have to be our own advocates in community advocacy, doctors supporting communities that are engaged in that advocacy work, such as the Historic West End, is vital. So within MAHA, you can join, and I'm hoping that all the physicians and health professionals on this call will consider, and in follow-up email communication, I can actually include the hyperlink for you to actually join. But once you join, it's a very, in times of commitment, it's a very low time commitment, but you would receive monthly newsletters just to stay up to date. What's, the current research. You'll learn more about events that are happening throughout North Carolina, including clean air events. So it's just a way to stay engaged with us on the health program side.
Thank you, Kirsten. And then, of course, other events that we have coming up, the second session for this series, it's called Air Quality and You. So it's focused more so on how air quality impacts us at all stages of our life, specifically for those of us that are more vulnerable to the impacts of air pollution. So how air pollution impacts children, how air pollution impacts elderly populations, pregnant women, etc. So we would love if you guys could join us for the second session. And again, Historic West End residents that attend both sessions are eligible to receive the $100 stipend. Then I also wanted to highlight for those Historic West End residents that are currently air keepers, which are just folks that have air monitors at their homes. We're having an Ask Me Anything on October 13th from 12 to 1. And we actually will have the founder of Purple Air. So the person who actually created the monitor itself on that call. So if you guys have any questions about your monitors, any questions about the data that we're collecting or any of that, I really encourage you to join that Ask Me Anything event. And again, we'll send out more information about that. But again, thank you guys so much. And thank you for staying an extra 5 minutes. I've included Kirsten's email as well as mine. Again, if anyone has additional questions, please feel free to email us. And we really appreciate your time. Thank you so much.